This is probably the best drug to get over the counter. If you have a sore throat or runny nose, this is probably the best drug to help with that. I've been a pharmacist for over 17 years and I know what I'm talking about.
Fellow pharmacist here. Let's see what he thinks.
You're gonna wanna head over to the cough and cold section. And you're gonna go past all these drugs right here that just have a ton of marketing. You're gonna look down here, bottom. This is my go-to product, chlorpheniramine.
So I think he's mostly referring to the second generation antihistamines like Claritin, which is loratadine, Zyrtec, which is cetirizine, or Allegra, which is fexofenadine. These medications definitely do have more marketing. They're newer agents, but they're arguably better as well. Let's talk about it. Second generation antihistamines are typically considered the best option when it comes to selecting an antihistamine for day-to-day use. This is because they traditionally have similar or superior efficacy compared to first generation antihistamines, and their side effect profiles are smaller. The original creator does note that the chlorpheniramine will have a side effect of drowsiness, and that's true. Chlorpheniramine and diphenhydramine are much more likely to cause drowsiness compared to second generation antihistamines, but it's more than that. First generation antihistamines are also much more commonly associated with something called anticholinergic side effects, and this will dry you up. This is one of those things that he actually touted as a pro, which it can be, but it can also lead to some side effects. So when it comes to me, when I'm making a recommendation for an antihistamine, I will traditionally recommend one of those second generation antihistamines. That's not to say use of chlorpheniramine is inappropriate for all patients. I would traditionally reserve those first generation antihistamines though if we are treating like an allergic reaction or something of that sort. Another downside to chlorpheniramine is the dosing interval is shorter than most second generation, where you're taking those once, maybe twice a day, and chlorpheniramine, you do have to take that every 4 to 6 hours. Keep following along for more pharmacy and healthcare fun facts. Absolutely no disrespect to this pharmacist. I'm sure he is a wealth of knowledge, but just my thoughts on it.